is amazing is that Dr. Burzynski has had a vision and a passion and a zeal for 40 odd years, put up with being called everything short of and probably even including a witch doctor, because of his firm belief that he can save people's lives. And I mean, what that says about his character and the fiber of his backbone to be willing to take that on, and to be alive when and recognized when it happens. I mean, there are many times in history where great inventors, the inventor has basically died or was impoverished before they had a chance to see the fruition of that great invention, and he's got a chance of doing that.
In 1840, Ignaz Semmelweis, an Austrian obstetrician, noted that over 20%, that's 1 out of 5, women giving birth in the hospital died 4 to 6 days later of puerperal fever. These women were then autopsied in the basement of the hospital. And the doctors who performed these autopsies wore no gloves. Can you imagine that? Believe it or not, they then would leave the autopsy room and go straight to the delivery room to assist other births without even washing their hands. Then Dr. Semmelweis' good friend and fellow physician accidentally cut his finger while he was doing an autopsy. In 6 days, this doctor died with the same signs and symptoms of puerperal fever. All of a sudden, Semmelweis knew. He realized that the doctors were transferring the disease from the autopsy room to the delivery room, and he urged his colleagues to simply wash their hands. For this unforgivable sacrilege, he was drummed out of the medical profession, and he died in an insane asylum. Now today, we have the same kind of arrogant commitment to belief. But with cancer treatment, we have $1 trillion business built on those beliefs. So if you think Semmelweis had a problem, just imagine the problem Dr. Burzynski faces. There was no money involved in hand washing versus non-hand washing.